281-265-7567. This program in part has been sponsored by Sugarland Heart Center. We'll be right back after these messages from our sponsors. Ladies and gentlemen, please visit All India Radio Facebook page and like it. Here we bring you news, information, calendar of events and interesting stories from around the world, round the clock. So please visit All India Radio Houston page on Facebook and like it. Thank you. Hey, and good morning, ladies and gentlemen. Welcome to All India Radio Houston. I am Dr. Nik Nikam, and you're listening to 1050 KCHN, Houston, Texas. If you'd like to join in the conversation, the number to call here is 281-745-4161. Now, from the Indian Doctors Association, we're going to switch gears and we talk about irregular heart rhythm and how we manage irregular heart rhythm in the field of cardiology. My special guest is Dr. Nilesh Mathuria. He is an electrical specialist who is commonly known as the electrophysiologist. And Dr. Nilesh, welcome to All India Radio Houston.
Thank you very much, Dr.
Give us
Nikam.
a little background about yourself, your training, and then we'll jump right into the topic of atrial fibrillation, one of the most common irregular arrhythmias encountered in cardiology practice.
Great, and again, thank you very much for having me, Dr. Nikam, and I appreciate the opportunity. So a little bit about myself, as you mentioned, my name is Nilesh Mathuria. I am actually a Houstonian as well. I was raised in the northwest part of town. Went to Klein High School, for those familiar with that area. Went to University of Texas, Austin for undergraduate, and then stayed in Texas for medical school at Texas A&M Health Science Center. Then actually did internal medicine and cardiology training here in town at Baylor College of Medicine. And then did electrophysiology, or this arrhythmia fellowship at UCLA Medical Center in Los Angeles. And then was on faculty at UCLA, and then now have been back in Houston now for about 3 years.
Fascinating, fascinating. You know, one time the engineers wanted me to come and talk to their group. I wrote an article called Heart, the greatest engineering marvel created by God.
That's right.
It has the hardware, the software, the valves, the muscle, the pump, the electrical system, and the blood supply, plumbing, hydraulics, everything. So I said every engineering science was included.
Exactly.
And we are going to talk about the electrical system of the heart. Okay, tell us, give us a little overview of the electrical system of the heart. Then we move to what is atrial fibrillation and why people get it.
Definitely, and I think this is how I even discuss things with patients when I see them in the clinic or in the hospital. First of all, how does our electrical system work? Number one is there's an electrical impulse that starts in the top chambers of our heart, and that causes that top chamber called the atrium to beat. Then those electrical impulses go to the bottom chamber of the heart, and they cause the bottom chamber called the ventricle to beat. And that causes the sort of lub-dub, you know, that you hear, the atrium and the ventricle beat in sequence. In atrial fibrillation, the top chamber, electrically speaking, goes completely haywire or chaotic. Where even if you are looking at the heart in atrial fibrillation, the top chamber, the atria, are completely just quivering and chaotic.
This is what I say.
Exactly. Just like a baby shaking a rattle or something. But that confuses the bottom chamber of the heart because it's used to a more regular signal from the top chamber. And that causes these irregular and very erratic heartbeats from the bottom chamber of the heart that people can feel. And that, in a nutshell, is atrial fibrillation.
How common is atrial fibrillation?
So unfortunately, atrial fibrillation is the most common arrhythmia that we see not only in the United States, but really worldwide. Just focusing on the United States, based on the latest census data, or let's say actuarial data, roughly 1 to 2% of all people in the United States have atrial fibrillation diagnosed. And that's really just the tip of the iceberg. Many people feel that number is much higher because many people have atrial fibrillation that is actually completely undiagnosed.
What happens, I'm sure this number goes up pretty significantly once people pass 50 or 60 years.
Exactly. So of that 1 to 2%, if you look at based on age groups, folks over 80 plus, nearly 25 to 30% of people,
one out of every third
roughly,
person
have at least some diagnosis of atrial fibrillation, whether they're in it all the time or periodically. And that has been shown in every study over the years that as we all age, unfortunately, in our 50s, 60s, 70s, 80s plus, the incidence of atrial fibrillation becomes much higher.
the more and more I am aging, the more and more I'm realizing that every system in the body kind of takes a hit, including the heart rhythm. Okay, let's talk a little bit about what causes this atrial fibrillation. Why do, as people get older, get this more commonly?
So that's a very good question. The short answer as far as what causes atrial fibrillation in any given person, the short answer is we don't still 100% know.
Yeah.
There is some component, at least for some younger patients, perhaps of some genetic component. Also for some people, other metabolic things can cause atrial fibrillation, such as thyroid problems or other very severe electrolyte issues. But unfortunately, what we do know is there are certain risk factors that can contribute to atrial fibrillation, and those oftentimes tend to occur as we age. Number one being high blood pressure, hypertension. Number two being diabetes, or three being any form of congestive heart failure. People with thick heart muscle, oftentimes due to high blood pressure. Also, even just obesity, being overweight, can either indirectly or even lead to things like sleep apnea, which can also lead to atrial fibrillation. So all of these things, unfortunately, all become much more common as we get 50, 60 plus, and unfortunately that can directly or indirectly lead to atrial fibrillation.
Ladies and gentlemen, you are listening to All India Radio Houston. I am Dr. Nik Nikam, and my special guest is Dr. Nilesh Mathuria. We are talking about irregular heart rhythm, particularly atrial fibrillation, which is one of the most common arrhythmias encountered in cardiology practice. Okay, let's talk about, if somebody comes to you or somebody is referred to your office for irregular heart rhythm, how do you approach this patient?
Sure, and that's a very common thing that we see. Obviously, as an electrician, as an arrhythmia doctor, that's the majority of the patients we see have some symptom of potential arrhythmia. And oftentimes the most common symptom is just that, palpitations, they feel something in the chest, something irregular. So what do? So number one, we just do an EKG. And of course, sometimes we can actually pick up things on the EKG. If, for example, if they're having the arrhythmia at that time, we can see what's happening on the EKG. Or even if they're not having the arrhythmia, sometimes we can pick up certain signs that could explain why they're having those arrhythmias. But unfortunately, many times people don't have the arrhythmia when they see us in the clinic or when they see us in the ER, etc. I have many patients that come to the ER multiple times, but by the time they show up to the ER, everything is fine. So all their EKGs are read as normal. So they're told all the time, you have a normal EKG. So they feel, gosh, am I going crazy? Am I feeling something? So that's when we have to do other things. So many times we place what we call event monitors, or almost like a walking EKG, where people can have little stickers on their chest and actually walk around, and we can record their EKG continuously, really 24/7, as long as one wears it for that, and they can go up to even 30 days. Even beyond that, I have some patients where perhaps they may feel palpitations only every few months. So even these monitors are not sufficient for that. So even now there's new technology where we can even implant a tiny little chip, even much smaller than even a thumb drive that we all have for our computers, etc. And that provides us 24/7 continuous monitoring of one's heart rhythm, whether you feel something or not. And that's actually been quite important and quite useful in as far as management or of even diagnosing arrhythmias, and then even afterwards to determine how well a treatment has been going.
The medicine is working. Oh, okay, that's right. Ladies and gentlemen, we are talking about atrial fibrillation, and my special guest is Dr. Nilesh Mathuria. If you have any questions about irregular heart rhythms or atrial fibrillation, give us a call. Our number is 281-745-4161. Okay, let's talk about, now you put this event monitor and you have diagnosed atrial fibrillation. What other tests would you do, before you go for the treatment?
Sure, definitely. And as I mentioned previously, there are many risk factors to atrial fibrillation. So number one, we oftentimes get full set of blood work to make sure there's no other obvious issues going on, like such as anemia, thyroid issues, make sure electrolytes and potassium, etc. are all within normal limits. Oftentimes, if that's the case, we'll also even perform an echocardiogram, an ultrasound of the heart to, again, make sure there is no problems with the valves of the heart, make sure there's no evidence of congestive heart failure, make sure the heart muscle thickness is all within normal limits. And if that's all okay, then we're basically left with atrial fibrillation. And of course, aside from managing, let's say, high blood pressure, diabetes, other issues that may be ongoing, but even if for a patient that may have no other problems, then we start talking then about treatment specifically for atrial fibrillation.
Okay. Ladies and gentlemen, you're listening to All India Radio Houston. I'm Dr. Nik Nikam, and my special guest is Dr. Nilesh Mathuria, and we are talking about atrial fibrillation. And I've been a cardiologist. I've been treating atrial fibrillation for 30 plus years. I'm almost giving away my age. But it is getting more and more complex because now, you know, before it used to be, okay, you need to control the rate.
Right.
But now the whole concept has changed. You know, when you're seeing a patient for atrial fibrillation for the first time or for the nth time, you have to look at the rate, the rhythm, its effect on heart function in terms of congestive heart failure, blood thinning medicines. There's a lot of issues with blood thinning medications that patients are constantly asking me, which you're going to explain. And quality of life, which is a big pointer today. And also eradicating atrial fibrillation. So let's take it from here and walk us through how you approach each one of these items, the rate, the rhythm, congestive heart failure, and all the things which I mentioned.
Definitely. It's a broad topic, but this is a very important topic because many patients, as you said, have these sort of very basic yet very important questions. They're diagnosed or they're labeled with an arrhythmia, then they're worried. Does this mean something? Does this not mean something? Do I need to act on this or do I not need to act on this? So as I tell all patients, atrial fibrillation, you're not going to die suddenly because of atrial fibrillation. This is not like a heart attack type situation. Having said that, there are two issues with atrial fibrillation. One is because the blood flow in the heart becomes irregular and not as smooth, there is a tendency for the body or for the blood to create little clots in the heart. And that, in theory, those clots can break off and go to different parts of the body. And in particular, if it goes to the brain, that can lead to a TIA or even a stroke for that matter. And so because of that reason, that's where these blood thinners come into play to prevent, ideally, any TIA or stroke. And that's very important. That's really the first thing I try to assess for patients once they are diagnosed with atrial fibrillation. Usually we place patients on various forms of stronger blood thinners if they have various risk factors for stroke, i.e. if they already have high blood pressure, if they have diabetes, if they have other prior heart blockages or congestive heart failure. And then even with that, as Dr. Nikam, as you've already alluded to, there's different approaches or there's different options now. Even 10 years ago, there was really only one option, and that was warfarin or Coumadin, as many people know. And really, that is a rat poison, to be exact. But now there are other medications which are a little bit easier to use. Warfarin or Coumadin, as many people know it, require various blood tests every so often, whether it's weekly or monthly. And unfortunately had many interactions with all sorts of antibiotics, all sorts of diet. If you want to eat healthy and eat salads for 1 week, that will mess up your whole levels, basically. So this is a big pain for many patients. And so now, over the last few years, there have been really 3 and now soon to be 4 new blood thinner options for this. Now, the limitations with this, although the positives are one can just take a medication once a day and not have to, once or twice a day, but not have to monitor levels. It's a new medication. There's a lot of, like with any new medication, there's a lot of new side effects being discovered. Lawyers are all over this, and you may see commercials all over the place regarding this. But at the same time, there are new options, and they are effective as far as hopefully preventing clot and ultimately TIA or stroke. The second issue is symptoms. We tell many people, why did you even come to the doctor? And if they did feel some symptoms, such as palpitations, and more often than not, actually, they don't feel palpitations in my experience. They feel more shortness of breath, fatigue, tired. That's the symptoms I oftentimes hear with regard to the atrial fibrillation. And then for those patients, then we try to determine what is best for them. For patients that are actually overall doing well and are not, and the atrial fibrillation is really not bothering them, many times we consider a so-called rate control strategy, where we just want to give medications to maintain their heart rate in a reasonable range that is not bothering them, but they may still be in atrial fibrillation on and off. But as long as they're not bothered by it, then we just take the medications and just try to make it more of a background issue. However, in some patients that are very symptomatic, that's when we discuss other specific medications or procedures to try to specifically get rid of or suppress the atrial fibrillation.
Okay. I know there are 1,000+ pages, books have been written on just atrial fibrillation. Let's give out your contact information for those who want to get more information, and then when we come back, we will switch to pacemakers.
Definitely. My number is 713-541-9955. I'm part of the Texas Heart Rhythm Center Electrophysiology Group. And we have clinics not only in the medical center, but also we have satellite clinics at Memorial Hermann Southwest in the Katy area, as well as the Clear Lake area.
Let's take a little break and we'll be back, and then we're going to talk about